Okay. Hi, Kaltrina, Bernhard, and Viviane. Thank you for accepting my invitation to facilitate a workshop for the International Society of Hypnosis.
Yeah, thank you for the invitation.
Okay, great. I know that you are going to talk about endometriosis, a quite common problem in young women, and I know that it is even more common than the people, the general population, think about. So I'm going to know how hypnosis can help the patients who are suffering from endometriosis.
You will hear about this in this workshop. I'm very happy to have my dream team with me during this workshop. Actually, I was not even knowing this word 3, 4 years ago until Viviane was psychological intern student at my institute and asked me about this topic, can we do something? And so somehow we will talk about what we can do. We will talk about what this illness is. We will do a practical workshop. We can do a live demonstration when somebody has this problem. And we will also make exercising different pain control things, techniques.
Good, great. Thank you. And I'm asking this question from Kaltrina. Kaltrina, from the medical point of view, because I know that you're a medical student and you're a PhD candidate as well. So, from the medical point of view, how do you see this disease, and how do you think that hypnosis can help?
So in general, endometriosis is when the internal lining of the uterus loses its way and is distributed all around the body. And why that exactly is, we're still finding out in research. But how hypnosis can help is to mentally control those outer linings that are originally from the uterus, but then distributed throughout the body. So endometriosis, most likely, since it is a chronic pain situation, can be controlled with mental techniques.
Okay. So do you mean that it's not only the pain of the endometriosis, but also the pathophysiology of the disease itself that can be affected by hypnotherapy?
Uh, We don't know yet in research, but we are on our way to find out. In general, maybe Viviane can share some of her experiences as well. It seems like a lot of women have already benefited from hypnosis and hypnotherapeutic approaches to control chronic pain and the symptoms that we observe as clinicians.
Okay, great. Thank you. So I know that, Viviane, you have some, let's say, degree of endometriosis and you have experienced it. So maybe you are the best person who can talk about the symptoms and how hypnosis or self-hypnosis helped you.
Yeah, so there are multiple symptoms in very various ways. So obviously we have the vegetative functions that are can be quite severe. Obviously the chronic pain, then we have malfunctions on the organs that are like where the cells that aren't supposed to be there are growing. We have obviously quite often infertility issues. All of that causes has been shown to cause various psychological issues as well, which are ranging from depression to insomnia to fears, and all of this obviously can be helped through psychotherapy, hypnotherapy, as well as healthier habits, because currently we are still very much looking at treating of symptoms in the medicine. There hasn't been, that origin hasn't been found yet. So we can help on a lot of those little factors. For example, one example, we have suggestions in the manual to have a craving for non-inflammatory food, just to mention one thing. So there's many levels on which we can try to improve the quality of life for women suffering from endometriosis.
Great. Yes, of course. The quality of life will be improved a lot. And as I know, we have a science called psychoneuroimmunoendocrinology. And according to that science, I expect that hypnosis and other psychological methods can have a positive effect on the disease itself. And I'm going to ask if this workshop is just about the theories, or it's a practical workshop and our audience can learn something about how to use your techniques in practice.
We will do all. So especially Kaltrina will talk about the medical part and the newest research. And I know we have been teaching together in Krakow at the International Congress, and especially expert gynecologist has been very happy about the new things Kaltrina was teaching. She was coming after the workshop and she was very excited about the new things. So you will hear, maybe even if you're expert, maybe you will hear something new in this, and you maybe will also have some ideas. When I heard this word, I was not ever heard this diagnosis. And then I had to find some knowledge. And I also will teach what you can do if a patient is coming and you first time hear this diagnosis, what you are doing, how I have been collecting the ideas, and how we developed this manual somehow. How I did this is also maybe interesting topic in itself, because we started with 0 practically and ended with a 6-session manual. Not only doing chronic pain, you will learn some chronic pain techniques. Also maybe one new technique I have been learning from a professional boxer, interestingly, but which I'm using in the meantime already several times with my patients. That is not published in any book. So it's a very easy idea, but a very practical idea. You can also use it for tinnitus patients who have ear noises. So you will learn some techniques you can use in different ways.
Great, great. And it will be an invaluable manual. And is it available for the professionals, or it's not yet published? Should we wait for it?
It's not yet published. It's only we have an online link where we are still working on it. We are still improve it sometimes from time to time and make it better, but it's nothing published yet.
Okay. I look forward.
Chinese colleagues have told me we should send the English version. She would love to make some research at a Chinese university. So maybe we should make an English version ready soon. Until now, we have it only in a German version.
Okay, great, great. Thank you all for this interview, and I'm excited to participate in your workshop. I know that I will learn a lot, and I invite all the people who are interested in the subject, either they are an ISH member or not, to participate in your webinar, Masterclass webinar on December 18 from 5 to 8 p.m. Central European time. Is there anything else that you want to add at the end of this interview?
Maybe if somebody would like to work with us and to have a live demonstration to experience hypnosis with a part of the manual, please write us in advance and write us a little bit what is the situation, what you have done until now, what is your goal. So maybe we could already prepare a little bit how to combine the things and how to bring the 6-session manual maybe in 25 minutes, the essence of it also.
Good, very good. So I invite all the people who are watching this interview, if they want to participate as a volunteer, as a subject to be worked on in the workshop, please just write it down here on the social media that you're watching to this interview, or write to email of the ISH or each of the teachers. If you have the emails, we can provide the emails to you to make this connection. Okay, thank you everybody. See you on Wednesday, December 18. Bye-bye.